hearing people that are on the call as well. So I want to make sure that everyone can hear clearly. Howard, if you wouldn't mind, please, muting your camera. Hello, Howard. Hello. Would you be able to please mute your camera? I have a quick question. I'm not sure if mine's muted or not. If I did need to know how to mute it, how would I do that? And one says, down at the very bottom of the screen, there's a small microphone and a small video kind of little icon. And you can press that once and it will give you the red symbol that tells you that it's muted. There are 2 interpreters. Are the interpreters able to hear? Are you able to hear, Johanna?
My camera, hold on.
I can hear Johanna. I cannot hear.
Okay, that's all we wanted to check.
Hello.
Hello. Hi, Colleen. I can see great. This is one. It looks good. Everything looks good. I'm waiting for MB, Monique. We have 34 participants altogether. So you won't be able to see all of them unless you swipe, and then you'll be able to see the other people that are involved on this call. There's 34 participants altogether. Hello, 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 everyone. Hi, my name is Juan. My last name is Fermero, and we work here at the CIL. This is my sign name. And if any of you want to ask any questions during the presentation, there's a chat box where you can type in your question, or there's also 2 interpreters. And those 2 interpreters, if any deaf person feels comfortable, you can contact either of the interpreters and ask them to please interpret for you, because if you want to sign your question, they can speak it. Plus, if any of you have any announcements, there is a microphone button. Just make sure that you aren't interrupting anyone who's speaking at that time, okay? Sounds good. Okay. Okay, and now it's time to start. It's about 1:15 at this point. So for our next presentation, we're going to have sorry, and we're going to go ahead and try to pin it. So don't worry if you have any other questions about the other presenters. We'll be doing, Monique will be the one that will be moving each video up to pin it as the person speaks. And this is Jennifer Sorry, that'll be next.
Good morning. I'll go ahead and share my screen so we can get started this morning. A quick introduction. My name is Jennifer Sorry. I'm a meteorologist at the National Weather Service in Huntsville, Alabama, but I'm joining you guys today for this conference. Thank you for the invite. I'm going to talk a little bit about weather safety and preparedness, including tropical, and any questions that you may have, please feel free, and I'll go ahead and get started. A little bit about the National Weather Service to start off with. There are 122 forecast offices across the United States, and each office is responsible for a select amount of counties. So my office covers 14 counties in North Alabama and southern Middle Tennessee. And you're able to get the forecast at any time. We issue watches and warnings for every season. And if you want to go to your individual office for your forecast, you can visit weather.gov and then click anywhere on the map to find your local weather information. So for Jacksonville, this is the Jacksonville Forecast Office webpage. And an example of their page and the information that you can find there is radar information, current temperatures, the forecast, and easy to understand graphics that quickly tell you about the forecast for the next couple of days. And also a little map that you can click on for your specific location for any watches, warnings, and advisories. For the state of Florida as a whole, there are several offices that cover the state: Mobile to Tallahassee to Tampa, even Key West to Miami, Melbourne, and Jacksonville. And that office is open 24/7 for if you ever have any questions. Each office has social media accounts that you can send in reports or ask your questions that way. And everyone will be able to reply to you if time allows. So make sure you know where you are specifically and which office that covers you. Specifically, the Jacksonville office, they have dozens of counties and also marine locations as well. So if you like to boat, they'll make sure that you get any marine warning. They also will let you know about rip currents as well, for if you like to go out and swim. And they're responsible for every watch and warning and forecast for all of these counties that are highlighted. So there are a couple ways to receive information when there's a watch or warning or even a forecast. But the most important thing is making sure you have more than one way to receive a warning. And make sure it's from a reliable source that you know is going to get you accurate and truthful information. And the weather is always changing very quickly, so we want to make sure that you check early and often for any weather updates. We have the weather radio, the alerts on your app, which are called wireless emergency alerts. You have our website, weather.gov, your local TV station, and your family and friends. But the sirens are out for outdoors, and so they may not be nearly as useful to everyone, and so we want to make sure you always have more than one way to receive a warning. And for the weather radios, there are special attachments for the deaf and hard of hearing populations. There are a white strobe light, a red strobe light, a bed shaker, and that will help alert you to the incoming watch or warning for your weather radio, so you can go seek additional information. And if you're not quite sure how to program a weather radio, I worked with folks in Tennessee to develop a programming instruction YouTube video that you're able to watch. It has captions, sign, and spoken English. So everyone is able to use this to properly program their weather radios. The wireless emergency alerts are free. They just need to make sure that you're turned on in your settings in your phone. And you won't get thunderstorm warnings, but you will get tornado warnings, flash flood warnings, and hurricane warnings. And this won't tell you too many details, but again, will grab your attention and ask you to seek additional information. So at least you're aware of the weather that is approaching. And these will vibrate your phone and make a really loud tone noise. So that is a benefit to also help grab your attention to this alert. Another great way is social media. So every office is going to do the best they can to get out watches and warning information, but there'll always be forecast information provided and letting you know days in advance of any severe weather or tropical weather. And through the storm and after the storm, continuous information always flowing through these accounts. But you need to check the timestamp. Make sure that is the latest post, and that is not outdated, has any outdated information. And you can share it quickly with others to help others stay weather aware. And it's also a great way to give the office storm reports. Is it flooding nearby? Did you get hail? Did you see a tornado? Is there any damage after the storm went through? And so that is really useful information for us to help us become better forecasters and to understand the storms better. And it may also help make better decisions for additional storms that come by, because then we know what happened with the previous storm. With these smartphone apps, there are many that you could choose from. However, you want to make sure that it's the best one for you. Does it send pop-up notifications? Does it vibrate? What will grab your attention that there is a weather alert that you need to know about? And beware of any delay that the app may have. So you may think that the storm is nowhere near you, but the data is actually old and delayed. So you may have less time to seek shelter than you think. So again, just watch for those timestamps and make sure that it's updated information and that the weather app, again, works best for you. And with TV, not every TV station does closed captions proficiently, and we work with our partners to help them best figure out how they can improve that for this community. Pick your favorite TV station, but make sure that you're utilizing the weather information at hand and not just relying on the captions. And so that's why I hope that we learn a little bit of weather safety today. So even if there are no captions or the captions are horrible, you're able to make the best decision possible on when to seek shelter and what to do with an approaching storm. And that's why we have more than one way to receive a warning and our weather information. So what technically is severe weather? A watch is when conditions are favorable for severe weather within the next 4 to 6 hours. It means remain alert and be prepared. It covers a much bigger area than a warning does. So it could go across a couple of states. A warning is a very small area, and it means severe weather is occurring or it's about to occur. And that means take immediate action and seek shelter and safety. And again, it's just for several cities, for example, it's much smaller. When we issue these warnings, for a severe thunderstorm warning, that's when the winds are about 58 miles an hour or greater, or there's hail an inch in size or greater. A tornado warning, we issue that when a tornado is occurring or about to occur. Some tornadoes spin up very quickly, and we try to issue the warning in advance, but sometimes we may cut it really short. So anytime you get a warning, you want to make sure you immediately take action. And for a safety review, what actions do you take during active weather? First of all, it's so important to know where you are on a map. So I know this is in Alabama, so this is my location, but know where you are, where work is, and the surrounding counties. Because you may hear that a storm is in Lawrence County and it's heading to Madison County, so you want to know counties surrounding you to best know where the storm is versus where you are. And it would just help you know if the hazardous weather is closer to you, and it could really save your life as well. So before the severe weather arrives, you want to stay weather aware. Know in advance if active weather is about to occur, and keep updated with the new information and changing weather threats as that storm approaches. And have a plan in place. Have your emergency kit prepared. Know where to seek shelter, whether you're at home, playing around in golf, or doing soccer with the kids. And practice this plan with your family. And if you're not sure where to even start about making a plan, FEMA has a great resource to walk you through those steps. And with emergency kits, personalize them to best suit you and your needs. Whether that's a whistle to call for help after a storm, flashlights and extra batteries, important documents, don't forget food for the pets, or even little activities to keep the kids busy. Whatever best suits your needs. Any medications, clothing, and even some tennis shoes, because after a storm rolls through, you don't want to step on any debris that may injure you. And have a solar cell charger that would be able to charge your phone for when the power goes out for an extended amount of time. It's also good to include different ways to communicate, whether it's a pen and paper, again with your cell phone charger, a whistle to communicate help, extra hearing aid batteries, and even a piece of paper that has contact information about where first responders can get interpreting services in order to best assist you. And if there are threats of tornadoes, look for emergency shelter signs, whether it's at the store or an airport. They'll lead you to where's the safest space in that location to go. Your personal storm shelter or a community storm shelter. Just be sure to evacuate mobile homes, and wherever you are, get in, get down, and cover up. You want to protect your head the best possible. And you want to have as many walls in between you and the outside as possible to keep you safe. Get to the lowest floor or basement if you have it. With lightning, stay indoors. If you're out in the open, find shelter in a building, not underneath a tree. when a tree is struck, you're able to also get struck as well. Stay out of the water. So if you're done swimming or if you're a boater, go find your way back to your boat landing just to be sure to stay as safe as possible. And stay away from windows. I love looking at storms. However, I want to be safe, so I'll stay away from windows, get in from the garage or the carport, and go back inside. And a new lightning safety slogan and logo has developed from my years of working with the deaf community and teaching weather. And we developed a See a Flash Dash Inside campaign where this focuses more on visuals rather than being able to hear the thunder, as the current slogan for the weather service is "When thunder roars, go indoors." And this logo was a deaf graphic design artist in town helped us make
Hello,
this.
can we pause for a moment, please? This is Money speaking. Right now, I have several people complaining they cannot see the PowerPoint or the interpreter. Can we fix this right quick, please? And as for the PowerPoint, they say it's not moving. Ms. Jennifer, which
Yes,
slideshow are you on right now?
it's moving on my end. I'm moving the slides back and forth. Are you able to see the change?
No.
I'm not sure. I apologize because it shows that it's playing on my end. I'm not sure. Are you able to see any changes?
No. Ms. Jennifer, can you click present on top of your PowerPoint?
Yeah. So let me just try to close out of this, and I'll do a new share, maybe.
Okay, I see you now. Yeah, you're moving it, you're touching the slide. We see that now. Thank you so much.
Do you see the flooding website or the slide? Do you see the changes between lightning and flooding?
Yes, ma'am.
Okay, perfect. The See a Flash Dash Inside is important because it goes off more visual cues, and lightning can strike even up to 30 miles away from the storm. So you want to make sure you keep an eye to the sky and take action before lightning strikes and go indoors to stay safe. And then some radar apps do have lightning data, but in order for that app to show you the lightning strike, the lightning already has to occur. So make sure you don't wait to get an alert that lightning is nearby. You make sure that you're seeking shelter before that approaches. With flooding, you want to never drive through it. You do not want to risk your life and the life of a first responder trying to save you when your car stalls out. Make sure you just move to higher ground, take another route to work, just avoid the flooded roadways. You never know if the road is washed out beneath it and you don't want to become trapped. Flooding is a leading cause of weather-related deaths in the US, and a majority of those occur in vehicles. So just turn around and don't drown. We are in the middle of tropical season, so many hurricane hazards include strong winds, tornadoes, storm surge, and inland flooding. Even if you're not right on the coast, you're able to feel those effects. So make sure you take hurricanes very seriously. Before the storm approaches, there's a few things you can do to be prepared. Determine your risk. What are the greatest threats in your current location? Here in North Alabama, that for us would be tornadoes, winds, and flooding. Make a written plan and share it with your family. Know if you'll evacuate with an approaching storm and what happens if you get separated. Are all your important documents together and into your emergency kit? And make that emergency kit. Make sure you have food, water, medications. Don't forget stuff for activities for the kids, for pets. Have cash, because when the power's out, your card will not work. We ran into that with a tornado outbreak here in Alabama. I didn't even think about my card not working to get gas. And make sure you have a way to power your devices. And again, any communication needs that you may personally need. And do an insurance checkup. Do you have flood insurance? What options are all covered within your insurance plan? And if you live in a surge-prone area, make sure you have at least 2 ways to evacuate. Again, you never want to drive through a flooded roadway. And even if you live on a high-rise and you choose to stay, still get to higher ground in an interior room and stay away from windows to protect yourself from the wind or any debris that may fly towards your safe space. Hurricanes can strengthen quickly, so again, always stay weather aware and get the latest updates. And with major hurricanes, those are a Category 3 or higher. They can have sustained winds of 115 miles an hour or greater. And remember, a severe thunderstorm, that was only 58 miles an hour or greater. So if you have one of these major hurricanes, the Weather Service will issue an extreme wind warning. And when you want to seek shelter right away, in an interior room, in a very well-built building, just as you would with a tornado warning, you want as many walls in between you and the outside as possible. For after the storm, use text or social media to get in check with family and friends. That way you can get as many people as possible in a short amount of time.
Sorry to interrupt one more time. Miss Jennifer, your slideshow is not moving again.
That is so weird. I guess I'll stop sharing and reshare like I did last time.
You could do that, and I'm thinking you have to click, click present on the top.
Jennifer, I think what's happening is when you hit present at the top, it's opening a new window, and we are not seeing your new window. We're only seeing the previously shared screen.
Okay. Let me hit present and then I'll do, I'm gonna do a new share.
Yeah, you might have to select what window you're sharing in Zoom.
Okay, there we go.
Are you able to see the storm checklist?
Yes.
Okay.
Yeah, the storm checklist. Thank you
All
so
right. Perfect. Thank you. For after the storm, I would also encourage you to follow local officials for updates and instructions. So you know any places to avoid or the best places to go, any shelters that are available, and when it may be safe to return to your home. Watch out for debris and power lines, and photograph any damage to help with your insurance. And make sure if you have a generator, you run it outside, never run it inside. And check in with your neighbors. Make sure everyone is okay. And I've been working with several groups over the past several years to develop deaf and hard of hearing educational weather page, and we have created several weather safety videos that include an interpreter and captions and are able to teach you about any of the topics that we talked today, whether it's hurricanes, rip currents, tornadoes, and more. And so I encourage you to check out that page when you like, and you can also share this information. It's free to share and help educate others and spread the word about weather safety. And there are a couple ways you can contact the Jacksonville Forecast office: through social media, email, and through the web page. And if you have questions for me, I also have my email listed below. And I want to thank everyone for the invite to the conference. And if there are any questions, I'd be more than happy to take them. And if you can't think of any questions now, you can always ask later. Yes, you can share the presentation. Everything is available to share.
Hello, everybody. Good afternoon. This is Monique. And so thanks so much for showing up to talk about the weather. So I'm just wondering if we still have any questions for the National Weather Service. And if there's any questions that anyone has for Jennifer, if you could ask them now. And one says, okay, if also don't forget there's a chat box, and you can pull up, you know, a video, and if you would like to sign your question, the interpreter can voice interpret for you. Okay, seeing that there's no more questions. Again, thank you so much. Big thank you to Jennifer for all her information. And now we're going to take a little break for about a minute or two, and then we're going to proceed after that with another presentation. All right, thank you, everyone. We'll be right back. Okay, everyone. I know that a lot of you want to watch the presentation, and that's great. That's wonderful. And I'm here in charge with Juan Fumero as well. And we're the ones that are going to be able to turn on and off your video. But even if your video is off, which is fine, and you're watching the presentation with the PowerPoint, if you don't see the PowerPoint with the presentation, then please, 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 please send something to me in the chat box or try to reach out and get some help. Because right now, we're having a little break. So if you have any questions so far, if any questions have popped up, now would be a really good time to type your question in the chat box, and I can get right back to you. Yes, I got a question coming in from Juan. Someone wanted to ask a question through video, and I did see that. So you wanted to ask a question through video, or can you type it in the chat box? Because that would be a little bit easier that way. Hi, hello, hello, everybody. Okay, so you can go ahead and turn your video off, okay? And that way you just sit back and relax and watch. All right. Any other questions to do with the video or any other issues with seeing the presentation? So right now, you should be able to see three. You should be able to see Juan Fumero, you should be able to see me, and you should also be able to see the interpreter. Those should be the three videos that are in your window right now. So, and then the weather host. We have a question coming in through the chat box. It says, my concern about deaf and blind people not knowing how to be prepared for emergencies. So I'm guessing you mean regarding this presentation, or specifically, do you mind explaining a little bit more, Colleen, about your question? Okay, so Juan, did you want to go ahead and move on from there? Yes, so hello everyone. And I just want to make sure that as everyone goes to this presentation, whenever each presentation is finished, you can go ahead and leave a question in the chat box or a comment. And if there's any questions you want to ask, that's fine to leave them there. But some other people really want to make, they want to email me if you have a question that you would like to sign. And that way we can open a video and you can sign your question directly so everyone can see it, okay? All right. And so now we're going to move on to the next segment. We have another deaf presenter. Many of you know them. Are we ready? Yep, so we're moving on now. We do have a presenter from FEMA. We'll be starting with Ms. Ferguson. Robert Ferguson. Is Robert Ferguson on the call? I'm not sure if Robert has joined at this time. Okay, recently he just joined just a minute ago. So we're going to give him a few minutes to set up. Hello, Robert. So now this is a next presentation that we have from FEMA, and this is Robert Ferguson. And we also have Charlotte Lewis on the call as well. And this is her sign name with the C. And hello, Charlotte. Good morning, everyone. Good afternoon, actually. Good afternoon, everyone. So I've just explained to them, everyone on the call, about Robert, and he will be making a presentation, and then as soon as he's done, they can have a few minutes to type questions in the chat box if anyone wants to add anything or have any comments. And then some people will probably sign their questions, which sounds good. All right. I'm waiting, this is Charlotte, I'm waiting for the video, just a minute, hold on. Hi, this is Juan again. Monique and I are working on some technical issues to share Robert's video with you. All right, seems like it's working now. Oh, sorry, I clicked on something and then it disappeared. Robert, are you able to share your screen with us? He said, well, okay, everything just cleared up. For a while, it completely disappeared on me. I was starting to freak out, but whoo, okay, all right, everything is good. So do you want me to go ahead and just share my screen, or do you want me to start with my presentation? Okay, I can share my screen, that's no problem. Thank you so much. Okay. If you're ready. Sorry, I missed that. So we work in collaboration with, we're currently a bit west working from home, but the headquarters where my position is called Acting Temporary Program Administrator. And I have two primary positions. I also work with Robert, and I believe he wants to introduce himself. And he says, yes, hi. Thank you so much, Charlotte, for introducing me. My first name is Robert, and this is my sign name. I work with FEMA, especially in West Texas. We have our own office there where we're set up. It's just the Texas office, and we mainly primarily work in Texas, Louisiana, Arkansas, Alabama, and Michigan, but we, do directly focus on Texas more. So, and we integrate in that area, and I'm responsible for collaborating with the state and also with the local government. And anything that pops up, we all collaborate together to make sure that everything goes as smoothly as possible. And all of that. And my job and my role have, for the last several years, been working as actively in headquarters. I do travel some up to Puerto Rico, to Georgia, to Arkansas, but mostly I do stay in Texas. Thank you so much for the opportunity to introduce myself, and also back to Charlotte. And she says, also, I just wanted to introduce myself. I'm Charlotte. And there's also one other person that I think is on the line with us, and their role, they're in Region 4. Let me see, where we integrate with that region as well. And that's Jonna. And I'm not sure if they want to introduce themselves, if they're on the call, if they can.
Hi, good afternoon. I'm Joanna Latimer with FEMA. I just wanted to thank you, Monique, and both Charlotte and Robert for being representatives at the conference today. And thank you for having me introduce myself. But I'm the Regional Disability Integration Specialist for Region 4. And here covering the entire region to include Florida and the rest of the 7 states. So thank you, and I'm looking forward to the conference.
And they're in the Southreach area. And they were asking me if I could present for all of you and communicate straight in ASL. I'm very excited about this opportunity and being able to discuss some issues and whatever else is thrown at me by the end, if you guys have any questions. And So let me give you a little bit about FEMA and my role as an emergency responder. And there's a lot of people who know that a lot of times after disaster, especially if a hurricane hits or something else horrible happens, FEMA shows up immediately. And we are first responders. We do cover all states, and which means that any information that you need to know, where to evacuate to, where the shelters are located, all that type of information has to be provided for your local area, depending on your state. The state is responsible for handling all of that. And so we work with the state to provide for shelters, for evacuation routes, make sure the internet is set up. There's centers where people can go to have access. We're a really great resource, and we partner really well with the state as FEMA and with the government as well. So we get there, tend to get there right after disaster strikes, and then we're able to work thereafter. So right now, there's a few things that I'd like to share with you that you guys can think about regarding an emergency, because you're there at home and you're trying to prepare, and we're here to support you. So the next slide will give you a little bit more information. One thing that you should keep in the back of your minds is that for emergencies, should be an emergency preparedness kit, and that your family and friends should know what your plan is, and you should also have a plan set up so that your family and your friends around you are able to check up on you, whether you have a disability or other needs. And so that's what we're going to focus on today. And then the next slide speaks about what is important and how to communicate that. If you need an interpreter, if you need closed captions, how do you get what you need to be able to communicate? So FEMA is not only for people with disabilities, we also generalize the general population. We're able to help everyone who has a need. So if there's a person who has no car, no way of transportation, or no access to that transportation, we're able to help them. We do help access with the bus system or subway. So it's another good thing to know. So if you if what your normal mode of communication breaks down, you're able to find another mode of transportation to get to where you need to get. So when you're thinking about your plan, it's good, to have a couple different ideas. And if your first idea fails or something happens, then you have some other ideas or a backup plan so that you'll know what to do. It's good to have several different modes of support. And then the next slide. It's very important that you know how to contact your local government, and you can find out where the closest shelters are, and you know where to go should disaster strike, and there's also a list. And make sure that you have everything that you need. That way you can be ready, especially if you have diabetes or you have medication that you have to take every day. Those are the type of things that it would be good to have on hand, and so that you at least have a medicine list, and so you know right away when you're ready and if you have everything packed that you need in advance. So you don't want to wait until the hurricane actually hits and then you're freaking out, where's all my stuff, and you're running around your house, but you should have a list ready so that you have everything on that list that you're going to need. So that way if your house floods or your electricity gets shut off or whatever disaster hits in your area, perhaps you have to vacate because of lightning or whatever else, other reasons, you know where you're going, you know what you need, and you have that preparedness plan in place. And that's very helpful information just to have on hand. So the next slide. So it's good to have a preparedness plan not only for yourself, as a deaf person, but also for your family. So example, if you have a plan ready, you should have it also for your animals, for your pets. And also you should know where the shelters are in your local area. Some of them don't allow pets. So some of them, now they have to allow service animals, but some pets are not allowed. A lot of shelters aren't able to take pets. So you should have a plan in place, who to contact, which shelters do allow pets, or at least a contact number so you're able to call them and ask what their allowances are, and also have a plan for your entire family. If you have a service animal, you need to know that as well. There's a website, and that website is ready.gov. And that website specifically answers a lot of your questions. And on that website, you'll see a lot of different resources as well as videos explaining what you can do, what you should pack. And it will give you a lot of information with ideas on how to be best prepared, not only for yourself, but for your pets as well. So that website is just a really great resource. It's a great place to go just to kind of get started. And a lot of forms are on there as well that you might need to fill out with lists, check off lists and all of that. And also who to contact, where to go, what to do. It's a great website. And after this conference is over, I would suggest that you go and kind of check it out. Next slide, please. Okay, so this is for the deaf and hard of hearing. Many of you already know this, but some of you may not know. NOAA, that's the National Ocean Association. They have a great weather radio with a light that flashes. It's kind of a warning light. And now many of you think, oh, if it's a radio, that's not going to be for deaf people, but they do. They have a radio with an attachment which lights up, and if you see that light lighting up, you'll know that, okay, it's time to go check the news, it's time to go on the internet and kind of find out some more information. Also, make sure you have extra batteries ready for your hearing aids. Make sure you have pen and paper so you can communicate with people by writing down stuff. If you have a phone, make sure that it's charged, you have an extra charger, that you also have maybe an extra backup charger so that if you need to go ahead and connect with a sign language interpreter or use your video phone, you're able to do that through your phone. Make sure you have several backup batteries if possible, so that in the case of an emergency, you have that extra power. Make sure that whatever your communication preferences, you're ready and supplied for that. Next slide. Okay, and then we're going to go over to Robert. And he says, first of all, before I start, just to explain about natural disasters before they hit, you want to be prepared. You want to make sure that you know where the exits are in your building. You want to know where the emergency exits are. It's very important that you have your kit ready, that you have all your basic needs covered, that you know where your family members are. Whoever lives with you, you have a plan for them. Plus, don't forget about yourself too. You have needs. Make sure that you are packed up and ready to go, that all of your needs are met, and that the next slide will show you, what a good survival kit would look like. So first of all, you're going to need a copy of your medications, a list. Make sure that not only do you have one, but that it's updated, because you should update it at least every 3 months, because a lot of times doctor will change your medications or change your dosage or change add a new one. And you want to make sure that whatever is on that list is something you can easily throw into a emergency kit and take off if you need to. So make sure that it's updated so that everything that is on your actual list is the medicines that you need to take. So at least every 3 months, make sure that list is updated. Make sure that everything is ready to go, and that you have emails, you have contact information for whoever you need to connect with. If you have a CPAP machine, make sure that that is also something that's on your list, so you can grab those things in a hurry. And you know, a lot of times when you're struck with a natural disaster, you're struck with something last minute emergency wise, it's easy to forget something. So make sure that you have everything on that list, not only your medications, but all of your very impersonal emergency equipment that you're going to need to take with you. So that way, if your house floods or if something happens, you don't lose all of your medical equipment. Make sure that all of that is on your list and that it's taken with you, because you don't want to, you know, have a half-written list that doesn't have everything on it. So make sure you have your insurance card with you. It's very important that you have this survival list, that you have your insurance card, that you have everything that you need so that you can contact everyone that you need, the medical equipment company, their doctors. Make sure you have all of that information on hand so that it's easy to get a hold of people that you need and be able to get the care that you need. If you need Medicare, Medicaid, all their phone numbers, you know, people that you call often, make sure that you have all your support, people who will be able to resupply any lost equipment or damaged equipment. Make sure you have this information before a storm hits. This way, when it does hit, or if something does happen, you'll be able to get that help and that support you need right away instead of having to wait a long time. Because if you wait a long time, then, you know, it may not be as simple of a fix, because they do have certain rules and parameters where you can only receive so much medical equipment within a certain time frame. So you want to make sure that in the back of your head, you know, will the insurance company cover it, will Medicare cover it, or what your time frame on is of each medical equipment. Also, I want to make sure about in every 2 weeks, you have at least 2 weeks of medication ready, especially if you have diabetes or something very serious, that you need to make sure that you have at least 2 weeks of medication saved up, so that if the electricity goes out, if something else strikes, a natural disaster, but make sure that you have that medical equipment ready, you have your prescription ready, you don't want to get stuck. You know, make sure you have, if you only had a couple days, you could run out during that emergency time. So it would be better to have at least 2 weeks of medication on hand before that happens. And also, if you have any health issues, if you have any allergies, you want to make sure that you wrote all those medications down on a list. You don't want to have any of them missing. That way, if you go to the Red Cross, if you go to a voluntary organization, somebody who works with medical staff, they will be able to see your history and have everything ready and be able to help you out as, you know, smoothly as possible. Make sure, you know, sometimes the phones are not reliable, because while you think they would be, I mean, there's chargers, things die, sometimes the power's out and you're not able to recharge the battery, so sometimes a phone will be completely useless. So make sure that you have everything regarding your health on paper, and also your friends or your family are all together, and that way you have everything ready in one spot that's reliable. So also, make sure if you have a band, you know, a medical band, make sure that that has all of your information, what supports are needed. Maybe sometimes people put on the other side, I'm deaf, or I have diabetes, or I have heart issues, or, you know, whatever, asthma, whatever your top issues are in case of a flood, you know, that way once, you know, everything, the flooding goes down and maybe there's mold developing or a lot of other infectious diseases or whatever, it could cause you to have some asthma breathing, but you can show it to somebody and show them, hey, I have asthma, I have this, I have that, I have breathing issues, and they're able to give you medication a lot quicker that way. So it depends, you know, if a deaf person like me, sometimes I get very frustrated and I'm having a hard time communicating and trying to write back and forth or text back and forth. It saves a lot of time to have a medical band and just show them a medical band, and they already know immediately what you're talking about. If you need glasses, make sure you have that. If you need anything that could be needed, make sure you have that, maybe water, extra water. You know, so you might think that one is plenty, but maybe have a backup just in case. Make sure you have your medical supplies. Also for your pets, pets have medication a lot of times. So we want to make sure that just like them, just like ourselves, we also take care of our pets and make sure that they have everything they're going to need. They're going to need food, they're going to need water, they're going to need medication. So when you're packing up your kit, make sure you pack for them as well. Okay, all right. So I just wanted to add one more thing real quick about packing in your kit. So suppose, you know, you have children. Now children have some children have sensory needs. They may need sensory toys or fidget toys. Just make sure you add some of those while you're packing up anyway. Children need things to do, books, drawing utensils, something to keep them busy and to kind of eat up the time, because a lot of times what happens in emergency situations is that, you know, you have to go to a new place and a shelter, wherever, and maybe they're just sitting there very bored and we're waiting for the storm to pass, or the house floods and you're waiting for the house, you know, to be unflooded to go back home. And in that time, you know, there's some things that they may need to stay busy. Also, paper is good to have. It's always good to have some paper. And copies of your list that you've, you know, created. That way, if you have to leave and go to a shelter, you're ready. And then I know there's some time you have to kill before you can go back home. A lot of times if things flood, everything's damaged and you're going to need, you may lose your ID, you may lose things like that, and you're going to need to go to an office. So it's good to have copies of everything. Have a good copy of your family details, your doctors, the family doctor, the family, you know, primary care doctor. Make sure that you can keep that communication with the physician. Sorry about that. I wanted to add one thing too. It's not only your local area, but also, you know, it's good to have one or two other contacts that maybe don't live in the same area. Because if the hurricane hit somewhere in Florida, then maybe everyone around that area will be taking care of their family and too busy to really become an emergency contact. So it's good to have someone who's maybe in Texas or Georgia or someone outside of that area who would be able to help an emergency situation, who maybe knows your medical history, knows the names of your medication, knows the name of your doctor, someone who they can contact not only where you're at, but also a little bit farther away, knows what hospital you normally go to, knows your, you know, important information. If you own a house, it's good to keep a title of the house and a deed to the house. If you own a car, same thing. Make sure that you keep a deed or a title for the car. And sometimes it's hard because if the hurricane is really bad and it hits the area really horribly, there's a lot of people that do pass away. So it's good to have paperwork on your family just to make sure that you can support everyone. And if sometimes, you know, you got to work on paperwork, you have everything ready to go. So Robert and I, a while ago, we worked, we used to go be sent all over the US to help people. We went to Texas during Harvey in the Houston area. We were there we were in Puerto Rico for Hurricane Maria. We also went to the US Virgin Islands for Irma. So we've been to a lot of different places, and people really struggle after a hurricane because they don't have any paperwork ready. Now FEMA often will kind of ask them, you know, do you own a house? Do you have any proof? Do you own a car? Do you have any proof? Do you have any insurance? And now they're having to make a plethora of phone calls trying to get everything back together. So it's good to have copies of everything in a Ziploc bag and then put that in your kit, because that way you can just kind of have that ready to go and not worry about it. That way, if you need it, you have that with you. Have a copy of your insurance, have a copy of your other really important paperwork, and just kind of keep that in your kit. So next slide. Credit cards, have your bank account information. Sometimes in the middle of a hurricane, what happens is, or a tornado hits, you only have 5 minutes. You have to grab and go, because you know, sometimes people accidentally leave their wallet and they get somewhere and they're like, oh no, I forgot my wallet. And they're trying to call their bank and figure things out. So it's good to have a list of your credit card information, your bank account information. That way it's easy to contact the bank and get a new card and say, hey, listen, I left my wallet home during the hurricane or during the tornado, I evacuated. And, you know, especially for tax purposes, anything that proves that you own the house is good too. That way you can, you know, have emergency contacts and family and other people that, you know, you can discuss what to do, or, you know, think of people that would have really good ideas and who you could contact after an emergency and that would work with you. It's not someone who has to be where you live. It can be someone, it's just important that that person knows how to contact you. And, you know, it's good to have them in case of emergency. I missed the question with Robert. He's asked something, but he wasn't on screen. He said, so just to add to that real quick, if you go to an ATM, make sure that you take out cash. Have cash ready. Have it in your pocket, because a lot of times, you know, the ATMs they run on electricity, and in the case of emergency, in a flash flood, in a hurricane, you may lose that electricity and you may not be able to get any cash out, or your card may not work. So sometimes it's 2 or 3 weeks before the bank starts getting everything back online again and you're able to use your ATM card. So you need to have enough cash to last through that time. And most importantly, though, then a lot of times people just think this isn't really important, or they think that they'll figure it out. They're like, oh, the ATM will be fine, it'll keep going. But you got to think about the fact that it runs on electricity, so it's very important. So if everything technological goes down, your ATM is going down too. You're going to be in the dark. Your whole life is going to be in the dark, including the ATMs. So a lot of things that you depend on, you don't think about, are actually run on electricity. So it's very important for people to, I mean, at that point, people just start sharing what they have and trying to, you know, figure out how to get through it. So this happened at the U.S. Virgin Islands. It happened with Hurricane Harvey. I've seen this happen a lot, and I've learned my lesson, and it's something I keep in the back of my head when I'm packing and ready to go. And as far as my kit goes, I always make sure there's cash as well. And back to Charlotte. So in New York City a while ago, it was back in 2003 in the Northeast, they had a blackout. Hold on one second, sorry. There was a big blackout and they lost all their electricity, and it was really rough, and people didn't know how to pay for anything at that time because all the credit card machines were down. And I had a little bit of cash. I had about 20, it was out for about 24 hours. And I had to look and look and look, and I finally found one ATM that was pretty far away that was still working. And I think maybe they had like an old generator or something that was running it, but it was still running. And there was a line, there was a crazy line, and I kept standing in line hoping there was enough cash left in this one ATM that I could get some. So finally I was able to get some cash out, and at that time there was a hurricane approaching. And luckily we had enough time to get that cash before the hurricane hit, and I was able to get some money out of the bank, get it in my pocket, and get out of there before everything went crazy. But you know, it's very important to keep that cash on hand beforehand. Next slide. Robert, we're going to go to you. I just want to make just a second, we're stuck. So that you know if there's a hurricane coming, that you're ready for a hurricane, that you're ready for a tornado, that you're ready for the impending weather. Because just very recently there was a hurricane, and it was headed towards Florida, but then it was supposed to hit Ocala, but then it suddenly went off course and hit somewhere else. So you may not be expecting the hurricane, but I'd encourage you to be ready for any inclement weather, so that if something does come to your state, you know, you may not have a lot of time beforehand to prepare yourself, but that you and your family are able to, at the last minute before it hits, guarantee that you're not gonna become just lost and so confused, but that you know where your family members are, that you're not separated, that you know what the next step is, that you have a place where you decided that if anything happens, this is where we're going to meet. So maybe if you live in Miami or Ocala and it's supposed to hit another place, but then it kind of veers off and it hits in your city, or perhaps it hits in Jacksonville, or perhaps wherever it does hit, that you have a plan in place so your family knows, hey, we have a certain meeting place. This is where we set up a meeting place so that if we do get scattered, if something does come, that we have a meeting place that it's easily identified, that we know we meet there. Maybe it's at the deaf school. Maybe, you know, your family just knows that in case of emergency, this is where we meet, so that if anything crazy happens, we get to that one place and we're able to communicate. So we have 4 main points that are very important that you discuss with your family, your friends, your next door neighbor, whoever you have that emergency plan with. The first one is, how will I be able to get the emergency information? How will I be able to get the warning? Not only will I get it, but how will I communicate that with other people? So if I do get that emergency warning, if it's a hurricane impending or whatever it is, how will I know? Is it the local government that's putting this out? Is it the state that's putting it out? But I also need to have an app set up so that I'll be able to keep abreast of what's going on and be able to know before it happens and know how far it is and when it's going to happen. So any information coming in like that, such as a hurricane. Now I live in Texas, and in Texas, a lot of times we don't have a lot of warning for hurricanes. So we'll get a warning and we kind of just make sure that we got some heavy towels ready, that we have our emergency kit ready. So, you know, a lot of times we have, you know, an emergency signal that goes out and it kind of blares out. Now, for us who are deaf, we don't hear those emergency signals. So that means that I have to find another way so that I can access that information. So I can get those warnings on hurricanes so that I know what's going on. Now in Florida, a lot of times you guys already know when it starts to rain a lot, you get real heavy rains, you're kind of ready. But something else that goes on here, there's a plan for the shelters, and it's good to know you're going to have to stay in a hotel, you're going to have to stay in a shelter. If you don't have any money or you're kind of struggling in that financial area, you need to have a plan. So there are shelters set up in place. There's Red Cross. There's also faith-based churches that have shelters, mission churches. They set up, you know, shelters as needed, and you should have a plan and know, you know, how to communicate and what you're going to do and where you're going to go. And especially with COVID-19, now that also adds another dynamic to it. You want to make sure that you keep yourself safe as well. So FEMA, Red Cross, we set up bases and shelters, which means that there's some that are not for the general public. We set up specific ones. Sometimes they're in hotel rooms, but one problem is, or an issue that we're facing, is that we know that many hotels tend to have a limited number of ADA rooms, ADA compliant rooms, which means that they may or may not have accommodations for your needs, so you may get kind of stuck. So at first, you know, we stick a lot of people in there, and then all of a sudden we realize, hey, we're out of ADA rooms. We try to move some people, or see if, you know, we can move some people to the first floor, try to, you know, provide for what they need. And some people need specific equipment, accommodations, and they need to be set up specific ways. So also for evacuation routes, it can be a little difficult. You have to study the map near your area and find out where your evacuation route is, what area you're in, which type of paths tend to block up, and if that's a way that kind of blocks up, you need to know where else you can go, what a back route would be for that main road. That way, whenever the time comes, you don't get stuck and you know how to evacuate or what roads to take. So, Charlotte, did you have something to add to this? Also, I want to add another specificity for Florida. Wherever the roads, try to avoid roads that have standing water. A lot of times people will try to go off the highway to try to get away from traffic. Just make sure that you have at least 2 or 3 different options or different routes that you know how to get around in case there's water, standing water, or, you know, other issues, electrical power down. Just make sure you have a backup route so that you don't just depend on the one highway that you know of. Also, you know, if you have a very old car that's kind of, you know, falling apart, make sure that you know, can that car last? Can it make it to Georgia? Start thinking about other modes of transportation if that one's not going to be reliable. Also, is there buses that are available, or what other options are there for you to choose from? So know your options. Maybe your car is in good working order and you know that it will make it. Ask your family members, hey, does anyone need a ride in case of emergency? Make sure that people that are going to need to evacuate as well can get out with you if that's necessary. Also, make sure with your family members and next door neighbors, communicate with them. You know, if the phones go out, if you cannot text someone, make sure that you can connect with your next door neighbors and make sure you can connect with their family. Make sure that you have access to communication with them, and make sure that if everyone who needs to evacuate can. Don't just take off and not think about your next door neighbors, don't think about your friends. Just don't act like you're on vacation and just peace out, and all of a sudden someone else is in very dire need, and then you come back and you didn't realize that that person was really in a bad position, that you could have helped them out if you had, you know, checked on them before you took off. So, you know, try to lessen the stress for other people. Everyone kind of gets stressed out during a natural disaster, so make sure that you're communicating with your family members, with your friends, making sure everyone's okay, making sure that they're safe, making sure that they have a backup plan, making sure that they're in a good spot. So, you know, if something does happen, don't just take off, because you don't want to have to turn back. Communication is key. So, you know, just make sure that you know who's in a flooding area. Make sure that you're communicating so that you know where to go, who needs to come with you, and what your evacuation plan is. Do not drive through standing water. It's very important. You could die. You could lose your life. It's very serious. A lot of times, you know, people, you know, try to drive through standing water, and it's very dangerous. Now, the most important specifically that you need to do to get ready for your plan is, and to make sure that you can survive through these things. Many deaf people, hold on one second. Sorry about that. Many deaf people have different needs. It doesn't go by just the fact that they're deaf, but everyone has their own specific needs. There's some that are senior citizens. There's some that are young, and they think, oh, you know, I don't have any limitations. I'll be fine. I can survive this. But a lot of times there's other reasons some people need this specific medication. So it depends on the individual. But now, not all deaf people are the same. They're going to have the same needs. Everyone has a bit different needs, so you need to make sure that your needs are met. Make sure that you're covered. So you need a family emergency plan. Speak with other people. Make sure you have your emergency contacts ready. Make sure your family knows where you are and you know where they are. If you have, you know, a good support system, maybe you have family that lives about 2 hours away, that can be your emergency plan. You know, is make sure that they can support your needs, and as long as that person can accommodate for what you need, you know, kind of having a plan of like, hey, if something happens here, I'll come there. If something happens there, you come here. Just make sure that everything is clearly laid out specifically before, you know, natural disaster strikes. That way, you know, you're ready. Make sure you're communicating with your work, with your school, with your local government. Make sure your boss knows. Make sure that you're letting them into the loop. Make sure that your children are taken care of, that they're covered, that your pets are covered. Whenever something happens, like a natural disaster or a hurricane, sometimes it is better to stay home and not evacuate, because, you know, sometimes you have pets that you love very dearly and you don't have anywhere for them to go. But, you know, FEMA, Red Cross, you know, we have laws, and we try to take your pets and help you, and there's places that we have, shelters that we have for pets specifically, that your pets can stay, where we are able to feed them well, we're able to take care of them and provide for all their needs. Especially if there's a need for medical equipment, or if a deaf person has a wheelchair, or has specific needs, we need to know what your needs are so that we can help provide for you. If you need a scooter, that's a need. We just need to know specifically what the need is so we're able to accommodate for that. And also make sure you have a backup plan if possible. Plus, we need to know specifically what's in your area. That way we can help you as best we can. There's a long list of all the things that you need, but we will do our best to accommodate for all of that. Charlotte, did you have anything you needed to add? No? Okay. Okay, so make sure you fill out a family emergency preparedness plan and have that ready. Make sure you also look at ready.gov, and there's plenty of checklists on there. There's plans where you'll see all the information. You can go ahead and just print those and fill them out. Make sure you have everything on the list, and make sure you make copies of all that and you hand it out to other people who will be helping you, other people that you trust specifically who can partner with you and make sure that you have everything that you need. Perhaps your boss needs to know what your plan is. You can give one to them just so they kind of are aware of what your plan is to make sure, that they can help you with whatever they need to. And practice with your family members. Make sure that your family plan is a well-practiced plan, that you know what routes you're going, where you're, and so that if one way isn't working, that you have a backup plan. And just make sure that your family knows where to meet in that kind of a situation. So it may never be perfect, but you can accommodate as you go along. Now, especially with hurricanes, there's always a lot of changes. So maybe you don't have just one plan, because that plan may fall apart, or, you make sure that you have different plans so that if, you have to change your plan in case of emergency, you have plan A, you have plan B, you even have plan C, so that, and you can go back to plan A if that ends up, being the best option. So Charlotte, did you have something you wanted to add to this?
I did want to add one more thing about practicing your plan with your family. So specifically, I wanted to touch on making sure that you're checking how each step goes. So making sure that you have your kit prepared, actually go through the motion of that. I don't want you to forget about it, because 6 months down the road, maybe every single year, you should decide to look at your kit, make sure that you have all of the information the same, no changes. So make sure that it's updated. You want to make sure you're doing that frequently and make sure information is up to date, because oftentimes you prescribe new medication or you remove a medication, you're no longer on it. So you want to make sure that that information is up to date and that you're prepared for when the disaster does hit. Make sure that you have batteries for your hearing aids or other hearing devices. You don't want them to leave there for too long, because then they are no longer working, they no longer function. So you might want to test your batteries, make sure that they still work. If they are no longer working, you can get rid of them and replace them. Because during that time, when you start needing things and things are no good or they ran out, then you're stuck, and you want to avoid being in a situation like that. So that's where practicing the plan comes in. You go through each step, you check and make sure that everything is good to go, everything's still functioning. Make sure it's working. And so once you go through all of those steps, make sure it's all the same, make sure you make your tweaks, things like that. So that's what practicing your plan really means. Back to you, Robert. I'm missing what he's saying. Yep, so now you guys should all know, and you should notice that the keys for having a plan, and the main concept is just having a plan. So you don't want, you want to make sure that everyone in your family is aware of what you're doing. You want to know where you're seeking shelter, where you're going to be staying in the case of a emergency. You need to know what pet services are available. You need to have a plan for that. Make sure that you've prepared your kit and that is good to go. You need to know what your family emergency plan is and have that established. You need to establish your communication plan and have all of these checklists that are already done and good to go. And so then that makes sure that you're good to go in case there is an event of an emergency. In case a disaster does strike, you have it all. So instead of having to reach out to others to see if they have anything available, or Charlotte saying, hey, can you please spotlight Robert, please? Yeah, can you change the video to spotlight? Yeah, would you mind changing it to Robert? Monique? There we go, thank you. Sorry about that, I apologize. I'll go ahead and start over. So first and foremost, you should be able to now know what the key lists are that you should have in place. So your emergency plan, your communication plan, you should understand what you need for your disability, what deaf individuals need, your functioning needs are. You should have all of that in place. And you should also know where you're going to be sheltering, what you can do with your pets or service animals, your support animals. You should have your disaster kit up and ready to go. You need to know what your family emergency plan is. And once you have all of these in place, including your communication plan, it should all flow beautifully. It should all work out perfectly. So if you have that all ready to go, all of it's in place, you have the best chance now to get that all established and ready to go. So you can practice it, you can be prepared to evacuate if needed, you have your kit that's ready to go, and you can go onto ready.gov like we discussed before, make sure you have all your checklists, everything in place, you have your kit prepared. You can contact your friends, see if they're prepared, your family, your friends, neighbors, make sure that they're taking advantage of the time now before these disasters do strike, so that way you can be less worried and you feel like you're more confident. You can take care of yourself in the event of a disaster. Charlotte, was there anything else you'd like to add? Monique in the chat says, any questions? Charlotte also says, any questions from anyone? Please go ahead and feel free to ask us any questions. Yep, I already responded to that question, Robert, thank you. Hi, everybody. So right now we're going to go ahead and take a break. And if there are any questions, please go ahead and type them in the chat box now. Don't be shy. Robert and Charlotte are here to answer all of your questions. So please go ahead, type out your questions, put them in the chat box. Come on, we're ready for them. Juan, I saw one person mentioned in the chat. Someone wanted to know the name of the person responsible for Region 4. Is that Joanna? Yes, that's correct. That is correct. Okay, I do believe that we have another question. Diana wanted to know, I think something also about their region. Yes, did you see that already? Charlotte says, yes, I did say that already. Okay, I do want to clarify. Joanna, well, actually, let me back up. So FEMA does have 10 regions. So regions 1 through 10, and they're all divided. So Robert already mentioned that he's in charge of Region 6, and that's the Texas, Alabama, Arkansas, that kind of region. So next we have Region 4. That includes Florida, Alabama, Mississippi, Georgia, South Carolina, that area. So that's region number 4, and that would be Joanna. She covers all of those states. So she covers the entire state of Florida. It doesn't matter what county or what area of Florida, she covers the entire state of Florida. So that entire area is under Joanna. That's her region. And that would all fall under region number 4. So if you want more information on what to do or who your emergency management person is, you can go ahead and contact Joanna. If not, then you can go ahead and check with your local county level, maybe a commissioner or maybe your mayor, they might have some information available for you, maybe some kind of government leader, and they might have an emergency management position that they can direct you to help you figure out more information, what you need to know, or who to contact directly. We at FEMA, we do encourage you to contact your local organizations like the SIL, or maybe you yourself know someone who you can contact that's more knowledgeable, or a person who's responsible for emergency management in your area, because that means that those people can help you with more information for deaf community in that area. So they can provide you with more access to senior citizens in that area. They'll have different kind of services that that they'll know and keep in the back of their head and can provide you with, so possibly for an interpreter, or for, they can give you more information about transportation or wheelchair accessibility, and that's for your county specifically. So they'll know more about the specificity of your county. Thank you so much. Juan says, thank you so much, Charlotte. Are there any more questions? Just go ahead and type in the chat box. And if you want to go ahead and type anything else, just go right ahead. They asked if there's a phone number and email for Joanna. Would you mind going ahead and typing out their contact information? Yeah, sure. So that slide that I had, unfortunately, I'm unable to share that with you, but online does have a lot of information, so I will go ahead and type out some of the information that's there. I can give you her email address, so you can go ahead and reach out to her that way. Her name is Joanna Latimer, Latimer. Perfect. Thank you so much. Latimer. So her email is now listed in the chat box, joanna.latimer@fema.dhs.gov. So that's her email through FEMA. She typically corresponds through that. Juan says, thank you so much, Robert. I wanted to thank you so much for that really wonderful presentation. I enjoyed it greatly. Thank you, Charlotte, as well. I appreciate you guys coming out, and you know, go ahead. Right now is our break, so go ahead and take a snack break, take a bathroom break. What time is it right now? Right now is 2:40. So next will be Partners in Deaf Health. That is our next presentation group. Monique says, thank you again, Charlotte. And Charlotte and Robert, thank you so much. Yes, that was really wonderful. It was impressive. Jennifer, sorry, thank you. Plus, also, I appreciate the 2 interpreters. Wow, you guys have a difficult job today, going back and forth between the presenters. So are you guys ready for our next presentation with Matt Starr and Miriam Paracha? We will see you guys after this presentation. Miriam's requesting, can someone spotlight me, please? Yep, right now we are actually on a break. So let's just break for a few more minutes, maybe 1 or 2 minutes, and then we'll resume with the presentation. Miriam says, I'm so sorry that I left and came back. I was a little nervous, so I needed a bit of a break. No, that's not a problem at all. We're happy you're here. You're going to be spreading great information. Matt's asking, can you see the PowerPoint, Miriam? Yes, I can. Okay, perfect. Just making sure. Hey, Matt. So I'll be starting and then we can go ahead and do our introductions. Perfect. Mary Beth, will you please let me know when we're ready to start? Okay, at 2:45, thank you. Monique, what's our end time? We're 2:45 to what time? Okay, to 3:15? Perfect, 3:15, I'll keep that in mind. Thank you. I just want to make sure I keep an eye on the time. Monique? Yes. Am I okay to start? Yep, sure thing, go ahead. Okay, hello everyone. Okay, hello everyone. I am Miriam, and here's my sign name. Today's presentation is about preparedness and safety messaging during hurricanes and coronavirus, COVID-19. So we do have an agenda for today, and I'll go ahead. You guys can read it for yourself. It's listed here. So first we'll start with an introduction, go ahead and go into COVID-19, preparedness for hurricanes in the COVID-19 environment, communication, self-care, and then a question and answer at the end. Okay, next slide. I will go ahead and introduce my partner in this presentation, Matthew Starr. He was born deaf and has been an emergency manager with FEMA in the Office of Disability Integration and Coordination. He is also a member and on the board of Partners in Deaf Health Incorporated. He did graduate with a degree in public health from the University of Rochester, and he's been serving a program for 18 years in New York. Next slide, please. I'll go ahead and introduce myself now. I was born in West Massachusetts, and I grew up in a mainstream school system. I then moved to Rochester, New York for a postdoctorate fellowship at the University of Rochester. I am also on the board of Partners in Deaf Health. And before I moved to Rochester, I was in a pharmaceutical doctorate program at the University of Boston. And I received a bachelor degree before that in biochemistry. So I'm going to go ahead and list a few pieces of information related to COVID-19 and its background. So first and foremost, that illness has been, it originated from Wuhan, China in the late months of 2019. And so they have deemed that virus the SARS-CoV-2 virus. And that has been shortened to be named COVID-19. So in March of 2020, the World Health Organization declared that the coronavirus is now a widespread pandemic. And it's important to know what coronavirus looks like and what symptoms it shows. So on the right, there is an image that you guys can see what symptoms it has. It includes a cough, shortness of breath, a high fever, shivers or chills, muscle aches or soreness, vomiting, diarrhea, and a loss of taste or smell. So those are a few of the symptoms, but you do often see these symptoms from anywhere of 12 to 14 days that you don't actually see the symptoms, but it does vary based on the individual. So you might not have all of these symptoms, you could only exhibit a few. It really depends on the individual. So now I do want to go back over and emphasize that coronavirus has gained concern because we're approaching the fall and we're approaching flu season in the fall. So we're going to see an increase of people concerned with having COVID, and you might also see an overwhelmingness determining whether you have COVID-19 symptoms or flu symptoms. So I do want to emphasize that you need to follow protocol, the 6 feet apart social distancing rule. You need to wear your mask, try not to touch your face or mouth. And I'm ready for the next slide. So I thought it'd be cool to show you all this website that you can check out for yourself. You can find out what the risk is for your local area, whether it's a high or a low risk. So this is the website here. I will provide you guys with this PowerPoint later after this conference is over, and you can access the website. So I won't exactly go into details about this website, but you can access it yourself, and it has a link available that you can open, and then you can select your local area and check it out. So you can select Florida in general and see the whole state of Florida. You can see Georgia, and you can see all of these different colors. So it ranges from a dark red to a light red or a yellow, and that ranges with the low to high risk of coronavirus. So you can see that the yellow means low risk. And so right now, it looks like most places are pretty high risk. So I'm ready for the next slide. Now I'm going to explain how you can prepare for hurricane season, especially during the coronavirus pandemic. So this year, our preparedness will look a little bit different than last year because of coronavirus. Stores and shopping for food or water or medicine and all of your essentials, you will need more time to get prepared, especially because you need to wear your mask when you go to your store, or you must do your shopping online to have it delivered to your home. I do want to recommend that when you go to your pharmacy, you should approach it a bit differently. Make sure that you there are 3 options outside of meeting in person. You can do mail order prescriptions, you can do a drive-through and buy at the window, or you can do curbside pickup. So there are 3 other options that keep you safe and avoid contact of being in person at your pharmacy. Also, for local authorities, they will issue evacuations. So you do need to see what shelter options you have. And you can also see what your friends are doing, what your neighbors are doing, and check on them. But you still should try to abide by the 6-foot social distancing guideline. So keep that distance while you do check on them. And just remember that 6 feet is the social distancing guideline. Next slide, please. So now we are going to turn it over to Matt, please, if we could spotlight him. Hello, everyone. Hello. All right, so I will be explaining this slide. I won't go over all of it exactly, but I do want to cover the important points. So we will send this out to all of you and you can review the slides later, but it's important to remember that in the case of evacuation, if an evacuation order is issued by the government, you must evacuate. And you need to bring this go bag. It could be a backpack, a briefcase, but you should have one go bag for the entire family. Or you should have one go bag for each person, not just a single go bag for your entire family. So you will find what you need to put in your go bag. There are lists available, checklists for what you should include in it. But don't forget about coronavirus, because you will need to include additional things such as hand sanitizer. You'll need soap. You will need wipes and masks, preferably two, at least two per person. And so I want you guys to keep in mind about the hand sanitizer and the washing of the hands. It must be 60% alcohol in your hand sanitizer. It cannot be less than 60%. So there is a specific type of alcohol that's required, not drinking alcohol. It's ethanol. So unfortunately, many of these stores that are selling hand sanitizer, they have methanol, and that is not the same thing. That's not what you want. So you do need to find ethanol with an E. That's what you need. And it needs to be 60% at a minimum. That's included in the hand sanitizer, because when you're touching so many different things during this evacuation, you need to be sanitizing your hands frequently. So next on the list, you do need to find where your shelter is, where the temporary shelters are. Now in Florida, we're extremely experienced with hurricane season. You know, we're pros at it. But here we have a lot of snow where I'm from. Florida, you're experienced with hurricanes. So maybe you've already gone through your first hurricane, maybe you've already gone to a shelter previously, you've experienced it. I do need you to keep in mind and not make an assumption that you'll be going to the same place again. Because of coronavirus, they have been changing and making modifications to their shelters and the buildings. So instead of maybe going to a high school and everyone flooding to a gym, and everyone in your town going to a single gym, they might be changing it to a hotel so they can abide by this, or possibly a college dorm where there's individual rooms where everyone can be separated. So it's important that you do stay up to date and you check ahead of time where your shelter is. And the next part, this last bottom piece talks about transportation and evacuation. So you do need to make sure that your car is ready. You need to have a full tank of gas, because when you start driving, maybe you hit Georgia, you need to be able to make it to Georgia. And if you wait last minute and try to get gas, you're going to be waiting in a long line. Okay, next slide, please. Okay, perfect. You can see here that there's a whole lot of words, but I'm going to go ahead and summarize it for you. So if you do decide to stay home during a storm, maybe there isn't a evacuation order, maybe you do have the chance to stay home at your own house, or you can stay with family or friends. You do need to prepare ahead of time and have that discussion about what to do about coronavirus and to keep you all safe from coronavirus. Doesn't matter if there's only 4 to 6 people in a house, you still should have that discussion, because there is a risk of getting the virus. So maybe just discuss how many rooms are in the house that you'll be staying, how many individual beds are there, what will you do if one person in the family does become ill. You do need to have the discussion of what you'll do. So just have a general discussion about the precautions for coronavirus. Also, keep in mind to not touch each other, don't touch your face. I know it's hard, I do know it's hard. On average, we touch our face about, like this, for example, we do this about 20 times every hour. You know, we do need to practice keeping it in your head that you don't touch your face when you sign the sign Y, try to move it away from your face a little bit. The sign for girl, maybe move it out just a few inches. Don't touch the face, and wash your hands as much as possible. It will help. Okay, this next point. This is saying how to stay safe after a hurricane. So I do want you to keep in mind that if you're staying at your home and it starts to flood, there is a risk of mold. I know Floridians are probably very experienced with mold, but mold is not good for your health. It does need to be cleaned and sanitized. So the American Red Cross Association does often provide cleaning supplies that you can use to clean after a flood, or you can request services to come. You will have to pay out of pocket, but you need to understand the importance of how to clean up after and the expenses that come with cleaning up after a disaster. You should keep your receipt because there is a good chance that you can get money back from FEMA, which I'll touch on later. So, you know, during an electrical outage, especially with coronavirus, it could be longer. You do need to be prepared for something like that with a power outage. Let me see what else. Stress that goes along with a disaster. It is a very emotionally charged time. I do know that it can be extremely emotional and stressful, and they do have services such as counseling available, and I can explain that a little bit more later and how you can get such services. Now, they do have services for the deaf. They have, I'm not sure if it's in person or video phone, but I will touch on that a little bit later, so just hang on. So once again, I'm not going to go over every single one of these because we will share this with all of you later, but there is important information on the next slide. So this right here, number one on this list, that's very important, are the attitudes. So I've worked with FEMA and I've already gone out for about 17 different disasters, and I've heard so many people that are frustrated or have all of these feelings about disasters and think that hurricanes are nothing to be worried about, nothing to be scared about. You know, they feel tough. They feel like they can handle it. And then once it happens, you know, they always think nothing bad's ever happened to me. It happens to other people. And that's where they're wrong, because it can happen to anyone. You know, flooding, in some countries, they have a high risk of flooding versus other countries, they have a very low risk. So they're not near water. They're not worried about it. They don't think that there's you know, they don't worry about flood insurance. It's not a concern of theirs. But 40% of homes in low risk areas for flooding, they experience flooding. So it's important that it should be checked and that you shouldn't think lightly of a serious situation. So that's our first point. Secondly, information overload. Oh my gosh, how much information do I have to retain? How much documents do I need to keep? Packing a go bag, preparing, making phone calls, writing these lists. It just seems like so much information. And then you just feel overwhelmed. You feel like giving up. You just, oh, I'll pray to God and hope that I'm fine. God will save me. It'll be okay. And now I know I've felt those same exact feelings. The feelings are resounding. But just take a deep breath. Just take it one step at a time and just pick the information you want to learn and work with, and you'll become better prepared. You don't need to try to do it all at once, do it all in a single day, do it just once and go. Just take it a step at a time. So third, how fast to get help. So if your home is on fire and you text 911 and say, my home is on fire, how long do the firemen take to arrive? Maybe 5 minutes. Police, how long does it take for them to arrive? You know, if someone breaks into your home and you were to contact the police, how long would it take for them to arrive? You know, maybe 7 minutes. They're pretty fast. They're pretty fast. Same thing with an ambulance for a heart attack. They get there pretty fast, any medical emergency. Now think about a disaster, like a hurricane, a tornado, a flood, any kind of natural disaster you can think of. How fast can help arrive? You think they can arrive in 5 minutes, 10 minutes? Of course not. It would probably take around 4 days, 10 days, or possibly more than a week. Now, it's important to understand that these emergency response people are overwhelmed. The fire department, the police department, they're overwhelmed. They've already been called to help from other areas. Everywhere is in need of first responders. So in the chance of a natural disaster, they're often requesting from the state to help. And they call in something like the National Guard to come to that state. You know, if the state is overwhelmed, then they reach out to someone like FEMA. So it's important to remember that FEMA only comes if the state requests for FEMA to come. And if it's approved by the White House up to the federal level, then they are able to come to your state to help with that natural disaster, and they take over. Or they don't take over, rather. They're there to support the state and support the state's decisions and what they want them to do. So FEMA is a support system for the state and to help that state's residents. They're not there to make decisions and to take control. So that's a common misconception. The next point I want to make is about misinformation, especially about coronavirus. And that's through the internet. Oh, it's been awful. So much misinformation has been spread. And it's overwhelming. It's mind-boggling how people are quick to believe all of this misinformation. You know, some people say, oh, well, they said yes about this. They said yes about, they said no. It's overwhelming. Everyone has their different opinions, but it's not a political issue. So we have done our research. We have our scientists, government. We have so many people learning about this new virus and making mistakes. But it's important that we're learning fast and we're being careful with all of this misinformation. That's the important part, that some people maybe don't trust the government, you know, and that's their choice. That's their decision to abide by their who they trust. And all that we can do is, oh, this last part on the slide with the, I'm sorry, we do need to provide people with reliable information. So it is your choice of who you want to trust. So I do want to touch on CERT, this next point, C-E-R-T, the emergency response team, the certified emergency response team. These are certified, trained people. They will have green hard hats on, and they go through training in first aid. They know how to help your neighbors. They work with the emergency department and people in that field. So it is something that you can consider joining. Anyone is able to join CERT. And all you have to do is contact your local emergency management office. It will be a local office, such as if you live in Miami-Dade, in that county. Miami-Dade County does have an emergency management office there. If you live in Jacksonville, I can't remember the name of the county, something with a D. They do have an emergency management office that you can contact and see if you can get connected with to work together. The next point, oh, actually moving on to the next slide. Miriam says, I would actually like to explain how to identify communication challenges. So before coronavirus happened, the deaf community, we were able to sign, work with facial expressions and lip reading and mouthing. But now with COVID-19 and all of these mask mandates, it does become a little bit of an issue and limit the facial expressions we're able to grasp. We can no longer read any lips. There's often just many challenges that come with the using of masks. You can't ask to move it down, so that is something that you need to keep in mind as a challenge. Some masks do have this clear window in front of the mouth, but there is limited supply of those. So we are working to produce more and have those more readily available for those that need it. So as time goes on, I'm sure that they will be able to produce and make those more available. Next would be interpreters. So normally during a natural disaster, there are interpreters available, but during COVID-19, there's less opportunities for interpreters to be available because of the restrictions in hospitals and with this pandemic and the need for PPE and protection for interpreters. So it is a little bit more difficult, and you do need to, they do need to provide interpreters. The next point about power, power related to so if power were to go out and cellular services are hard to connect, or if you're stuck trying to communicate and you can't reach anyone, maybe it's frozen, that's something to consider as well during a hurricane.
And if, you know, there's a lot of new apps out these days, and you can look through the app store and pick an app that you're comfortable with, and go ahead and go through that app and make sure you're comfortable with it and you have it kind of a good idea. So you can see what other people are saying in your area, and you can see a lot of other notifications right on that app. So whenever you download that app, make sure that, you know, some phones, they have facial recognition, and you can get in real easily. Now, if you have a mask on, you're not going to be able to use that option. So you have to set up a password. Now, if you do forget your password, it's going to be a bit difficult. So make sure you write that password down, or maybe put it on a small card on the back of your phone inside of your case. That way you don't forget, and you can manually get into the phone if the facial recognition isn't working due to a mask or something. Now, if there's nowhere to plug your phone in to charge the power, you can purchase something called a solar charger, and that charges itself with the sun, so you're able to charge that way. That's very helpful in those type of times where there's no power, no wall power available. And it's very important that you have communication, that you're able to access those apps and other information. There's something called telemedicine. Let me spell it again. Telemedicine, T-E-L-E, medicine. And that, now let me explain a little bit about telemedicine. So normally in a normal situation, you'd be able to visit the doctor. You'd go into the office or into the hospital and see a doctor face-to-face and be able to take a physical exam or whatever else you needed to get done. And then after the appointment, you'd go home. So now with the coronavirus and everything that's changed, a lot of people are using telemedicine. So they've transferred all of this into a website, and we are going to actually visit with your doctor virtually. They also have interpreters. Instead of having an interpreter in person, you're going to have an interpreter on the screen, which is a little bit awkward trying to get all of this planned out and set back up. But there's plenty of organizations that already have protocol in place and health services that know how to provide for interpreters during the coronavirus, during all these changes, and when everything's going to telemedicine and virtual. The interpreter will show up on the screen, but sometimes you need to be a little bit more patient. Like if you went to the doctor, and sometimes you have to use VRS, but the person on the screen won't be able to see the doctor. It's a little bit nicer because the doctor is on the screen as well, but it still has its own challenges. Next slide, please. So another something I wanted to propose that would help you guys out is to find when you're looking for a good app, or one that's, you know, specifically something that you're comfortable using. You can, you know, say you were going to somewhere and you wanted to communicate with someone who's hearing. They don't sign, you don't speak. So you might maybe want to open up an app where they can speak and it translates it into closed caption and you can read it. There are some of those apps out there. You just kind of got to find one that you're comfortable with that works well. It's a great resource. It's called Speech to Text. Next slide. And then also you can text back, and sometimes they can actually read it out loud to the person. So, you know, find one or two that you're comfortable with, practice with it, see how it goes. I'm a big note person. I like using notes on my phone. Many of you already know all of this information. It's quite popular at the moment, but VRS, video relay services, I really want to emphasize, you know, pick a VRS app. You're not going to just pick one and go with it forever. It's good to have more than one, have a backup plan. So if for some reason that app isn't working, you can open up a different app and use one that would possibly be working at that point. Because sometimes they're kind of glitchy, so you might want to start with one. If you're having some issues in that app, use a different one. So you want more than one app for VRS so that you can use one if the other one fails. But, you know, become familiar with it, use it. Also, you know, it's good to have different options. There's one called text at the bottom, text relay services. That's good too, especially for if you can't get on the internet, you have no Wi-Fi at the time, then you can use that in text something, and it will text it to the interpreter. It's like a TTY. It's a little bit more delayed, but at least it works still. Something else that's on the list for deaf-blind is a text enlargement app. So if anything that you're reading can kind of blow that up a bit bigger and make it easier to see. This is very important for everyone preparing for the hurricane. As we explained before, how to make a survival kit. And that survival kit is, you know, a bunch of things that you can put together and set to the side, and you won't actually need them until disaster strikes. And when the hurricane is impending, or you needing to evacuate, or this is something you don't want to leave home without. It's already ready to go, and things that you don't want damaged or things you're going to need to keep yourself safe, you have these things already packed up so that once the hurricane, this list will, you know, this list or this kit will help you through the hurricane until after it's over. You need water. Very important to always have water, because water is, you know, you need a whole gallon per person. So figure out how many people. If there's 3 people, you're going to need at least 3 gallons for one day. So you need 1 gallon per day per person. So, you know, on average, a hurricane will last for about 3 days. So if you have 3 people in your house and you know it's going to last possibly 3 days, you need at least 9 gallons of water saved up and set to the side. As far as food goes, it's very important to buy food that's not going to needs to be refrigerated, because, you know, you don't know if you're going to have power. You don't know if all of that's going to go out. So it's very, very important to look at the food and make sure that it's not required to be refrigerated. Non-perishable is the correct term. Make sure you look at the back, and if it says keep refrigerated, that's not the food that you're going to need to put aside. So make sure it doesn't say keep refrigerated, and that's something that you can put aside, you know, for a hurricane. Beans are good, canned vegetables, canned fruit, anything in a can, or perhaps like a dry box would be good, something that would be good to set aside. Also, it's good to have a flashlight. It's very important. It can be very dark, and, you know, you might need to see, to sign, to lip read. So a flashlight's a good idea to have in your kit as well. Some extra batteries, an extra cell phone, or other things you might need to communicate. Medication. If you go to the store, you may not be able to get your medication last minute. So it might be good to have at least a week's worth of medication set aside just to be safe until everything opens back up and you can go back to the store. Hand sanitizer, personal cleansing, you know, shampoo, body wash, things that you're going to need to clean yourself. Put that in your kit. Personal paper, a medication list, Health information, make sure you have all of that. Proof of address. An address book.
You also need information for your family doctor that you can put in there. So you want it on paper. You don't want it on your phone. You do want to make sure that you have a hard copy of it. That's important to remember. Also, having cash available. You don't want everything to just be on a credit card because you won't be able to go to the ATM. So you do need cash. Possibly if you're going to the grocery store or the gas station, you can use cash to pay rather than credit card. You will also need a emergency blanket. You want to have that inside of your kit. And it's also important that you have a map available because if you go somewhere, you know, typically we use our GPS. We're all pretty reliable on our phone. But what if our phone isn't working? What if our phone is dead? So you do need a backup plan. And, you know, an old-fashioned map is that backup plan. Next slide, please. And feel free to go ahead and read through more of these things that you can keep in that kit. And so this list just has more that you can have available at your home and just have it put together, such as a mask, rain jacket, rain supplies, a towel, maybe gloves. You're just going to want all kinds of things that are on this list, another blanket, extra clothes, plastic sheeting. You might also want duct tape, scissors, all kinds of different entertainment things. Next slide, please. This list also has advice for if you are to go to the grocery store. You can add more if you want, but this is just a simple list of having water, at least 3 gallons per day per person, shelf-stable food, canned goods such as vegetables, fruit, meats, beans, peanut butter or nut butters, and crackers, and also trail mix or dried cereal. So this is just a little list. You can add more. I would recommend not buying one. You would want at least enough for 2 weeks. Next slide, and I'll bring it to you, Matt, if you're prepared.
Okay, I just wanted to add something real quick. You know, while you're packing, you might start to get overwhelmed and think, oh gosh, this is so much. Don't stress. Whenever disaster strikes, you're going to stress. So you need to have everything ready because everything kind of moves fast. So right now, while you have the time, it's blue skies. It's a beautiful day. You have time to prepare. You have time to go shopping. You have time to think through this list. So take it easy. Give your mind some peace and don't stress yourself out with this. So that way, when disaster does strike, you'll be completely ready. So many people are not ready at all, and that is when it really gets complicated. Okay. Recently, we mentioned about a lot of, we give you guys a lot of information. So it's been, you know, it's hard to know, you know, which thing, which is good information and which is bad information. There's a lot of information out there. So Miriam and I just shared with you some of the information that we found to be very beneficial. And so it's very accurate information, and here's a list of reliable information. So if you want to know some more, you need some more information, you want to take your own time and go ahead and look through these videos and resources. It's very insightful. So let the SIL know if you have any questions, and they'll try to reach out to us if there's any issues with the links. Miriam, did you have anything to add regarding this list? Okay, I think we're going to move on. Miriam says I have one more thing I wanted to add. I had seen one question from someone sent it to me privately. It says, this is from Juan from Mero. He says, hey, as far as hand sanitizer goes, what kind of alcohol did you mention that was the correct? Is it isopropanol or is it ethanol? And, oh, sorry, I moved around. Oh, Matt said, sorry, I just took myself off. Okay, so the question said, which is the better type of alcohol to buy for hand sanitizer? There's two different kinds of alcohol. There's one that's called isopropanol or ethanol. Now, I prefer ethanol. If they don't have any with ethanol in it, it's okay to buy the one that says isopropanol. That's clean enough. It's good. It's just that I have a preference over ethanol because there's a lot more alcohol content. The propanol tends to be a little bit weaker, so the ethanol is a bit stronger. But that is a great question. If anyone has any other questions, go ahead and ask now. And one says, yeah, we'll go ahead and if anyone has any questions, go ahead and type it in the chat box and we'll try to get to everybody. Anybody got questions? Go ahead and ask. Any questions? I'm happy to answer if anyone has any questions. He said, wow, you guys really went through that list very, very in detail. That was really clear. As I was reading that list, that was really neat. Also, I want to make sure you guys know who to contact, and if you have any questions, you can ask that now too. You guys did a wonderful job. Thank you so much for your presentation. This is Monique. It's just been really wonderful. Thank you so much. So we're going to take a minute or two of a break and we'll get right back to everybody. So if anyone has a question, go ahead and leave it now, but I just really want to make sure we told you thank you so much for your presentation. It's been really enlightening. And I'm just so happy that you guys were able to come today and present. I've really definitely learned something. So thank you so much for being here and thank you for your presentation. Thank you to Juan for putting this whole thing on. And Juan says, yes, I have a couple questions here. One from Colleen. She just wants to thank everybody. And then also we were talking about the PowerPoint, and yes, the PowerPoint is done. Most people are just constantly saying thank you so much. Thank you to everyone for all that information. Thank you to Matt. Thank you to Miriam, to both of you. Thanks so much for being here. And I think we have another presenter too, right, Monique? Monique says, yes, we do. And Matt says, real quick, be safe, thank you, bye. Monique, Miriam says, bye, thank you. Okay, now we have another presenter, Jackie. This is her sign name. Hello, Jackie. This is her sign name. Hello, hello. Are you there? I saw the name somewhere. JH, I believe that is Jackie Haig. Hello, Jackie. Hello, hello. And Jackie says, thank you so much for introducing me and for inviting me here. I appreciate it so much. Hi, Jackie. Well, we're going to turn it over to you to go ahead and present. And after your presentation, then we'll have like a little bit of a deaf chat. And after that's finished, then we're done. So, and Jackie says, wonderful. So for right now, if you'll go ahead and start your presentation. See you later. Thank you so much. Thank you for inviting me here. I really appreciate you all showing up today. It's been a great presentation so far with all the presenters. And now it's come down to me. And there's only 2 left. We're going to talk about shelters. And we're going to also talk about hotels. Now, I just wanted to give you guys a few examples and some pointers as to what's really important that I found, recently. And let me pull up my PowerPoint really quick. So in preparing for hurricanes, it's important to find somewhere where you can go. And it's important to know beforehand where you're going to go, so you don't arrive and not sure what you're supposed to do. So before you leave your home or your apartment, it's good to have all your things put together and ready to go. Make sure all the things that you're really going to need for survival are put together, and that they're not all over the house, that you've had them packed, that you know exactly what you need, before the winds hit, before the rain starts, before there's any damage done to your home. So you're going to need to have all of your things put together. You don't want to wait till the last minute and be kind of forgetting things and going crazy and trying to grab things last minute. You want to make sure that it doesn't become a chaotic event. You want to know that where your things are and that they're packed up and ready to go far before the storm hits, so that you're able to evacuate safely. Make sure that your windows are closed. Make sure that they're barred and that you have boards up if necessary. Make sure that your garage is, closed and everything is set up. If you need sandbags, make sure those sandbags are in place. Make sure that the doors are closed and any of those small cracks underneath the door where air can get in, make sure that those are also closed off. Know where you're going. Know if you need to go to a hotel, where that hotel is located, what their rules are, if you need to make any type of payment, or if you're going to go to a shelter, make sure you have all of that information ready. And once you've decided, make sure you inform your friends and family members where you're going and what you're doing, and so that they know what your safety plan is and they know where you are and that you are safe. Also, if you happen to lose your electricity, have a plan. So you're not lost without any internet or any communication access. Make sure you know how to communicate with other people and what your modes of communication will be. Also, if you're going to make a drive, make sure that you know the route. Perhaps if you get into one route and it's just jam-packed with traffic, know if you're going to have enough gas. Make sure that your gas tank is completely full. Make sure that you have emergency equipment in case you need to pull off. And then sometimes if you do pull off the highway to take a back road, just know that that could also be slammed with traffic, and you might hit that as well, even on a back road. If you're going to Georgia, if you're going to Alabama, just make sure you know the route that you'll be taking. Make sure that you know general directions. Make sure you have a map and that you know where you're going. There is a website down at the bottom in the corner, if you can see that. It's floridadisaster.org. And that's a good website to access. Go ahead and become comfortable with that. And there you can see by county where all the shelters are. Especially being deaf or hard of hearing means that we have special needs. We have specific needs. And those shelters, there are shelters that are prepared for those specific needs. There are some, shelters that have generators. There are some that are just for the general public, and then there's some for the special needs that have specific abilities to cover for those things. Not every shelter is going to be able to accommodate. So you need to go on that website and make sure you know the shelters that do have those accommodations that you're going to need. And there's a picture of it right there. And there you can see a registry, and you can go ahead and click on that, fill that registry out, and that informs them ahead of time that you have special needs, and it saves a lot of time in the long run. And just to have that communication open, and so that they know, you know, even if they are busy, they're able to send you notifications, and you can get all the information ahead of time. There's also, you know, some people are deaf and blind, or they have other health issues. So if you have any of those, you're able to register, and so that they will be prepared to help you should disaster strike. So if you don't want to read through everything, you know, there is a lot of lists. There is also, you can share the PowerPoint, and there's some very important information specifically on these, and you can click on that link at any time, and it will bring up specifically the shelters and their locations. It's important to register. Make sure you do register. You don't want to wait till last minute and you get somewhere and it's possible that they turn you down because they don't have any room. They say, oh, I'm so sorry, we're full. You know, it's important to register beforehand so that doesn't happen. There are also other shelters in Georgia and Alabama, and you can evacuate to those. This is regarding Georgia. Again, they have evacuation routes, and on that website, there's really great information, and you'll see very vivid pictures and the roadways, and they have a lot of different examples of what it would look like should you take each evacuation route. And you can kind of click through there for yourselves. They do have a lot of shelters in Georgia and along the evacuation routes. It's a really great resource. There's list upon list upon list with specific count by specific county, and you can see all the locations, their phone numbers. It also has a lot of other information, whether you can bring your pets or not, what's allowed, what accommodations will be provided at specific places. So go ahead and make yourself familiar with those. They have a lot of information as well for Georgia and Alabama. So once you arrive, you'll be able to just relax and know that you're in somewhere safe. You know, it is going to be a bit confusing, but you're in there with everyone else. So, you know, you just have to know that, hey, I'm here, I'm safe, and let that be enough. Bring your masks. Remember before the presenter was explaining about all the things you would need to bring. So just to make sure that you keep those in the back of your mind. And then all of those things are for safety. Make sure you're washing your hands often. So especially if you're in a hotel, you know, you'll be by yourself, so that should be pretty clean. But you gotta, sometimes you have to bring your own soap, you have to bring your own washing agents. So just remember that. If you're in a hotel, you might want to call beforehand and find out, you know, what you need to bring so that you don't have to worry. Whether you're in a shelter or a hotel, you're going to have clothes with you, but you don't want to bring a whole huge suitcase. You know, you don't want to be laden down with a lot of stuff. So you just need enough for a few days, maybe a couple t-shirts, enough for 2 to 3 days, and you can change them as you go. Also, while you're packing, if you can't fit everything inside of the shelter, just know that there's not going to be a lot of extra room because there's going to be a lot of people. Make sure you have your mask with you. It's very important. Also, it's important to know what you're doing with your pets. You don't want to leave them at home. So it's good to call the hotel ahead of time and make sure they have accommodations for pets, or make sure that you can bring those pets with you. And, you know, if they're ADA pet accommodations, you know, then you need to let them know that as well. There's a lot of information on these websites, and make sure you keep abreast of all of that and are very aware of it. don't wait till you show up at the last minute and say, hey, I have a dog. Is that okay if I bring your dog in? Make sure that you can bring that dog with you in the first place, because they still have rules at each place. And, you know, you want to make sure that your pets are safe. Hotels, a lot of times, they fill up easily. Sometimes you can be on their website and have to do a lot of research before going there. Make sure that they're ADA accessible, because the general public tends to grab up the rooms really quick. So, you know, if you have a wheelchair or if you have other needs, just make sure that you get an ADA accessible room on the registry. There's a place where you can check that off. So if you're losing hearing, don't worry about where it says hearing, go for deaf or hard of hearing. So when you're typing it out, when you find a hotel room, when you go in, it's important that you choose the hotel wisely. So show them, make sure that they're ADA accessible, make sure that the hotel, when you book it, says ADA accessible. So you have to look, you have to make sure that you double check and look through all of their accommodations and make sure you may need a TTY, you may need a flashing light, an alarm clock, you may need a flashing doorbell. So they have several, they should have several for several rooms. So it's important to stay safe. It's important to, you know, don't get lost in the mix. Make sure you're communicating your needs and that you're able to have access and have communication where you need it. It's the same thing with mobility. Make sure if you have a wheelchair, you're picking a room that's wheelchair accessible. You don't want to get stuck in a room where you're not able to move about in the same way as someone else would be. You can type in the name of the city before you arrive and figure out which hotel has accessibility. So make sure when you're picking your room, you're picking one that has the ADA accessible rooms. You can do that in any state. Feel free to record anything from the PowerPoint, and I'll have that available later. Make sure that the most important thing to all of this is that you're not waiting to the last minute. You're not taking off and driving somewhere where you haven't already made accommodations. Make sure that you're safe and make sure that you're prepared. Thank you so much. Has anyone, you know, thought of any questions? As far as the shelters go, I have found so much information online. Each county, like Lee County, has really great information. You're able to click on Lee County and then it will show you all the shelters. If you don't see any special needs shelters, that means that you need to look in the surrounding area and go out a little bit farther and find something that has a special needs shelter, because there are special needs shelters. Sometimes even if they're not right in that county, they're right outside that county. And hey, this is Juan. Jackie, we had another question from Diana Tift. And she says, thank you so much. There's a lot of different resources out there, not just one. Down below, you'll see where it says for shelters that with some special needs. It's under the name Baker County. And they have a registry, so you can go ahead and sign up for that registry. And you can tell them about your communication needs, and it's for everyone around there. So people who even aren't in Baker County, if you can get to Baker County, you can register specifically for all those who live in Baker County and around that area. If you need help, they can also answer all of your questions. And we have a question from Michael Riggin to everyone. He wants to know is you can bring a cage for your cat or dog into the shelter. And the answer is yes, as long as you know if it's a pet open, if the shelter is open to pets. Now you need to, if they are open to pets, you absolutely have to keep them in a cage the whole time. So they do have, if it's a service animal, that's a bit different when you arrive. Maybe you need the cage, maybe you don't. But if you're going to be staying the night, we don't want any accidents to happen. So if you do arrive, you must have a cage. It's good to, even if they didn't require it, just to have it as a backup, because you don't want to get kicked out if you can't keep your animal under control. So a cage is always a good idea to bring with you, just to play it safe. If anything happens or if your animal gets unsettled, it's good to just go ahead and be able to put them in the cage to keep them settled. Okay, does anyone have any other questions? This is Juan. Anybody have any other questions for Jackie while we have the chance to ask her? Or if anyone wants to ask by video, you can do that too. And Diana asked another question. She said, is there communication access if the deaf person just walked into the shelter? And the answer to that is, it depends. That's why it's so important to register first. You have to register as special needs. That way they are aware what your communication needs are. They know who needs what. So they'll be knowing that someone will be needing. Now, if you just arrive, there's no guarantee that there's access or communication access for you. But it's always good to kind of either get an extension number and call that, or let them know beforehand that you're coming, or try to make an email and send it in. Because if you just walk into a shelter, there's a lot of people who just walk into the shelter, and everyone kind of needs help. And so people who are working there, most of them are not going to know how to sign. So it's important that you do the registry beforehand and let them know your communication needs. There's another question from Diana again. She's wondering if the Red Cross has guidelines of how to deal with deaf consumers. And the answer to that is you can look on the website, and a lot of information is there. It's the floridadisaster.org website, and there's a lot of general information as well as some more in-depth. And there you'll get a lot of answers to your questions. They have their guidelines on that website, which are very similar to the Red Cross. Is there any other questions? Oh, I see another one. And that is true. That's true. Yep, thank you. Trisha has a question. It says, would there be interpreters there ready for the consumers? And the answer to that is just best to be prepared. Don't wait till last minute. If you're deaf, don't wait until the last minute to just show up. Register now, which means, let them know, hey, if an evacuation occurs, I'm going to need these things. So put down your information. That way, when it's time to go and a hurricane is on the way, all that information will populate in the system, and they'll know, it's not like no one will have any idea who will be showing up, but not only will you know what's going on and you realize that you need to go to the shelter, but also all your information will be in there. I think there's another question now. It says, will there be interpreters that are ready there for the consumers who show up? Now, I'm not sure if there'll be specifically be interpreters there. I doubt it. I doubt it. It depends on what their rules are. You can communicate with the shelters beforehand, though, and kind of try to figure out, if they're able to provide for that. Now, I know it's 2020. This is a new year. There's a lot of things that have changed. There's a lot more communication, but we need to prepare. Thank you, Jackie, so much. You did such a wonderful job. This is Juan. Thank you for your presentation. You gave us a lot of valuable information, and especially about the hurricane shelters. And I just really want to thank you so much. I really appreciate your time. I've learned so much, and I'm really excited so far. We've had so many different presenters with such a valuable plethora of information. And now we know. Plus, we're able to think about not only the hurricanes, but also with all the COVID pandemic going on, and I feel a bit more prepared. I feel ready. I know what's going to go on, right, Monique? Is that how you feel too? She said yes. I agree with you, Juan. Definitely. I feel like all the presenters have really given us some really valuable information, and I feel very informed and ready should something happen. And it's been great to see everything in sign language too. This has been really wonderful. So thank you so much to Jackie. Thank you. Thank you, Jackie. Thank you so much. Okay, so now we're gonna go over to Diana Tift. Hello, hello, Diana. Hi, I've really enjoyed watching all the presenters. There's been a lot of information presented, a lot of great information, really. And so I also wanted to kind of tie it together. Now, the reason why, now I'm from NIC, and I moved here back in 2001. And then we had a really bad storm, and for about 2 weeks I was out of electricity. It was very frustrating, and you know, I was trying to help other people that were going through this tough time. And so this was back in, then again in 2015, we did a retraining again, and we've been trying to do these trainings monthly to keep everyone abreast of all the new information, so that the deaf have a chance to do craft. So we want to make sure that the family, you know, if somebody gets hurt, everyone's connected. They also teach you how to do first aid, and if, you know, something needs to be wrapped or you need to take care of something, because something could happen between 4 and 10 days before you're able to get actual help. So we want to help people be ready, help people be prepared. And this is really good, valuable information. But I did do an outside, you know, if you have CERT and you talk about it in small groups, and then you have people kind of break out into some bigger groups and kind of practice on, you know, people who are hurt, and try to help people, you know, who need it. So trying to help everyone become a little bit more prepared for that type of situation. Hi, hi, Juan. So right now, I recently took over for CERT, the CERT class. This was back in July, I believe. And they limited it to 10 people, but it's a good question. I'm not sure when it's coming to your area, but I don't know if your area can do it via Zoom, or if you're going to need to get a sign language interpreter. I'm not sure exactly how that would work, but if you talk to your CERT in that area, you should be able to figure out and request an interpreter and be able to get it from there. So is there any other questions that anyone has? Yes, hi. Yes, hi. And Joel says, yes, I wanted to go back to something you were speaking about. You said something about an app. And I did try to send it, but I got no response. And so I also got no response the second time I sent a question too. And so let me repeat that real quick. So I'm going to repeat it again. I had an experience where I had some issues with the app, and it kept informing me there was an emergency. This is back with Isaiah. So it kind of got on my nerves because of the, it was so fast. It was maybe early in the morning and didn't give me a whole lot of time. And then the battery kept dying over and over and over. So I would like to ask, is there another app that would be better that wouldn't drain my battery so quickly? And if you have an answer for that, thank you so much. Jackie, I think, spoke about apps, right? Was it Jackie who was speaking about that? No, I think it was Miriam, but she's gone now. Oh, that's right, it was Miriam. Well, what kind of app are you talking about, Joel? What kind of app were you talking about? Well, there's some that are good for emergencies, but there's some that eat your battery. So he's worried about, Miriam had mentioned that there was some better apps that maybe it wouldn't eat your battery so much. Oh, he's gone now too. Okay, well, Joel, we'll try to ask some questions to either Miriam or Matt, and then we'll be able to email you back with an answer a bit later on. We'll let you know. Okay. Monique said, did you see what I said? Hello? Oh, in the chat box, it says, Jennifer, sorry, says to everyone, she wrote a little message up here. It says, the National Weather Service does not have an app.
Oh, okay, so you'll have to use the app from the other weather service. Okay, so Jennifer did respond to the question about which app you can use and it is better for warnings related to weather disasters. So she suggests the BARON, Barron, the weather app from Barron. It should be in your app store that you can use to download. And so that should be better for what you're requesting, Joel. So thank you, Jennifer, for that suggestion. There is also one through FEMA. So they do have an app as well. It shouldn't be too overwhelming and it shouldn't consume too much of your battery. So do make sure that when you download an app, that you enter the correct zip code for your local area and not just your state. If you enter your state, then you're going to get more alerts and you're going to be overwhelmed with flood and weather information. It's going to zap your battery. It's going to completely consume your entire battery. So if you enter your local zip code, another suggestion would be to get an app from your local news station. Juan says, yes, thank you so much. The FEMA app should work as well. Thank you. Yep, the FEMA app too. That's a good idea. Thank you for that suggestion. I hope Joel understood that. Joel, we will be in contact with you to give you more information about that app, okay? Are there any more questions? There's lots of resources in the chat box right now. Thank you, Diana, for that, for the CERT online resources on there for ready.gov for you to access CERT. Wants us, yes, thank you, Diana. Thank you for that. Monique also says, thank you to Katie Nguyen for the resource here in Jacksonville and Duval County to get alerts and news for the local area in Duval. So you can get text alerts and messaging that way and email notifications. Are there any other questions or any other online resources you guys would like to share? Please go ahead and share them in the chat box now so everyone can have access to them. And if there's any questions, go ahead and share your questions with us. Other than that, I do want to once again thank every single one of you. I want to thank you a million times for this wonderful conference, this great presentation to share with everyone. It's all wonderful, valuable information, and I hope all of you were able to learn something, keep valuable information in the back of your mind, prepare, improve your preparation plan. We don't want any kind of last-minute craziness. We don't want to prepare. We don't want to be on deaf standard time. We want to make sure that we're not waiting until last minute and we're as prepared as possible for such natural disasters. We want to lessen the stress as well. So thank you to Juan, if there's anything you have to say. Yes, really, I had no idea what today's conference was going to look like, and I'm so amazed. We learned so much, and just myself, I learned so much about preparation that I didn't even know. And really, most of Florida, we've seen the waves of hurricanes. Sometimes it's sunshiny, sometimes it's pouring rain, and it's our bipolar weather. It's the funny little comment we like to call it. But hurricane seasons are a different story. That's the reason why we see such terrible disasters that happen, and you have to prepare for situations like that. So I've learned from the past that just preparing for 1 week isn't enough. You really should prepare for as much as 3 weeks. Get enough cash so you're not relying on the ATM or the bank. And Robert, that was valuable information that you shared with us. If power goes out, what are we going to do if there's no cash on hand? So really, I just wanted to repeatedly tell you guys, thank you so much for all of our presenters. Jennifer, Charlotte Lewis, Matthew Starr, and Miriam Paracha, Jackie, and Diana. I don't know if I'm spelling all of these right, but just thank you so incredibly much. Oh, I do believe we have one last question. Will you all be sending us the PowerPoints? And the answer is yes. Yes, we definitely will be sending you all of the PowerPoints. We are going to be working on that after this. Any other questions? Oh, I'm sorry, Diana. Tift. So thank you so much. Thank you once again for all of these questions. You can see that there's people from Jacksonville. We have someone from Miami. So thank you so much for everyone who joined us. Have a wonderful day. Please stay safe. Yes, please stay safe, stay healthy, says Monique. And I will be sending every single one of you the PowerPoints. So I'll be sending that to your email. I hope I have all the right emails on file, so I'll be sending those out to all of you. And for those of you who'd like to contact me through phone, you can go ahead and contact me that way, and I'll send out the PowerPoints to you individually. Okay, thank you, and bye-bye. Bye, thank you all so much. Oh, and thank you to my interpreters too. Thank you so much. That's right. We forgot to say thank you to Johanna, and Sierra. Thank you so much.